Welcome to UMCC Medical Consultant Connectors, where your health matters to us. An abdominal hernia happens when a part of your body pushes through a weak spot in your abdominal wall. This can occur in various parts of the abdomen, and it often results in a noticeable bulge or lump. This wall is made of muscle and tissue. It plays a crucial role in maintaining the integrity of your abdominal cavity. It holds your organs in place, ensuring they function properly and stay protected. Think of it like a fabric bag. The bag holds your organs securely, just like a fabric bag holds its contents. The bag holds your organs. If the bag has a weak spot, something can push through, creating a bulge. If the bag has a weak spot, something can push through. This is similar to what happens in an abdominal hernia. That is like a hernia. Abdominal hernias are common and can affect anyone regardless of age or fitness level. Many things can cause them. These include physical strain, chronic coughing, or even lifting heavy objects improperly. These include aging, injury, and even pregnancy. Each of these factors can weaken the abdominal wall over time. Hernias don't always cause problems. Some people may not even realize they have one, but they can be painful. The discomfort can range from mild to severe, depending on the size and location of the hernia. In some cases, they need surgery. Surgical intervention is often required to repair the weak spot and prevent complications. It's important to understand hernias. Knowing the symptoms and causes can help you seek timely medical advice. That way, you can get help if you have one. Early diagnosis and treatment can make a significant difference in managing the condition. There are many reasons why hernias happen. Understanding these causes can help in prevention and early detection. One primary reason is muscle weakness. This can be due to various factors, including genetics and lifestyle choices. Our muscles get weaker as we age, making us more susceptible to hernias. Another significant reason is strain. Strain happens when we put too much pressure on our muscles, often during activities like heavy lifting or intense exercise. Some factors make muscle weakness more likely. These include aging, chronic coughing, and heavy lifting. Chronic coughing can be particularly damaging as it repeatedly strains the abdominal muscles. Some things increase strain on the abdominal muscles. These include pregnancy, obesity, and straining during bowel movements. Constipation can lead to excessive straining, which puts additional pressure on the abdominal wall. If you have these risk factors, you are more likely to get a hernia. Being aware of these can help you take steps to reduce your risk. How do you know if you have a hernia? The most common sign is a bulge. This bulge is usually in the abdomen or groin. You might notice the bulge more when you stand up. It might go away when you lie down. Other symptoms include pain or discomfort, a feeling of fullness, and nausea or vomiting. If you have these symptoms, see a doctor. They can tell you if you have a hernia. Section 4. Diagnosing an abdominal hernia. Doctors use different ways to diagnose hernias. Usually, they start with a physical exam. The doctor will feel your abdomen. They will check for a bulge. They might ask you to cough. This can make the hernia more obvious. Sometimes doctors use imaging tests. These tests can show the hernia in more detail. Imaging tests can include ultrasound, Connecticut scan, and MRI. These tests help the doctor decide on the best treatment. Section 5. Treatment and prevention. In this section, we will explore the various ways to manage and prevent hernias, ensuring you can lead a healthy and active life. Not all hernias need immediate treatment. Sometimes, if the hernia is small and not causing any discomfort, your doctor might suggest a conservative approach. This approach is known as watchful waiting. It involves regular checkups to monitor the hernia and ensure it doesn't get worse over time. During these checkups, your doctor will keep an eye on the hernia to see if it changes in size or starts causing symptoms. However, if your hernia is large or causing significant discomfort, surgical intervention might be necessary to repair the weak spot in your abdominal wall. Surgery is a common and effective treatment for hernias. It involves reinforcing the weakened area to prevent the hernia from recurring. There are two main types of hernia surgery: open surgery and laparoscopic surgery. Each has its own benefits and considerations. Open surgery involves making a larger incision in the abdomen to directly access and repair the hernia. This method is often used for larger or more complicated hernias. Laparoscopic surgery, on the other hand, involves making several small incisions. A camera and specialized instruments are used to perform the surgery with minimal invasion. In addition to treatment, there are several steps you can take to prevent hernias from developing in the first place. These preventive measures include maintaining a healthy weight, using proper techniques when lifting heavy objects, and consuming a diet rich in fiber to avoid constipation, which can strain your abdominal muscles. By understanding hernias and taking proactive steps to prevent them, you can maintain a strong and healthy abdominal wall, reducing the risk of complications and improving your overall well-being. UMCC, your ultimate medical consultant connectors.